This week on To the Contrary.
First, is this the end of Planned Parenthood as President Trump signs a bill to allow states to defund it? Then, should health insurance companies cover gender-reassignment surgery? Behind the headlines, are Americans experiencing a First Amendment crisis?
Welcome to the Contrary, a discussion of news and social trends from diverse perspectives. Up first, family planning showdown.
President Trump signed a bill allowing states to withhold family planning funds from organizations that provide abortions, such as Planned Parenthood. The money in question never funded abortions. The bill, signed by the president in private, reverses a rule put in place by President Obama, which said the money must be used to pay nonprofits that provide family planning services, whether or not they perform abortions. Democrats say the bill will deny poor women access to contraception, fertility, and pregnancy care, even cervical cancer screenings. All these services are subsidized by Title X. But Republicans counter this rule will allow state governments to make the choices that best suit them.
So, Ann Stone, how will low-income women be impacted?
Well, I think that there may be some short-term confusion, but the gaps will be filled, and Planned Parenthood will be just fine. They'll survive.
It sends a pretty clear message. We don't care about poor women's health, and it's going to have a really detrimental impact on communities.
I think it's no surprise that Republicans are moving to find any means necessary to defund Planned Parenthood.
Well, you know, this is political pandering, and poor women are caught in the middle, and they will suffer the consequences.
Tell me how the services will be made up.
Well, I think, first of all, Planned Parenthood will have people that will step forward and fill in the funding gap. 6 of the 8 wealthiest people in the world are liberal Democrats, and they all support Planned Parenthood, so they can draw on those 6 to begin with.
You mean Bill Gates should step in and
all of them.
play the federal government?
More than just Bill Gates.
I mean,
there's
how realistic is that, Ann?
I think it's very realistic because all of them do support, and Warren Buffett is another, they do support the programs of Planned Parenthood. But beyond that, the market will fill in. There are other clinics out there that don't provide any abortion services that will get the money. You know, I think that ultimately, we're hoping to educate the Trump administration, because I agree with Susan Collins when she says if you want fewer abortions, you fund family planning. So if the ultimate goal is to reduce abortion in this country, you not only have to fund the current family planning, but find better measures, because 60% of all abortion is due to the failure of contraception. So we not only have to fund what we have, but we have to improve it.
Do you think low-income women are going to find a way around?
Well,
are we going back to illegal abortions?
Why are we doing this?
Let me ask you this. I mean, I know they don't have access to the birth control, but will they get access to illegally possibly things like RU-486 or abortifacients?
Uncharted territory, absolutely. You got the infrastructure. Includes Planned Parenthood clinics that are not funded with any federal money to provide abortion. You're dismantling that infrastructure. We know other states that have dismantled the infrastructure, like Texas in 2011. They defunded 2/3 of their reproductive health services. Now they have the highest rates of mortality for women during birth. So the evidence show that doing this is harmful for women's health. And congratulations, I hope your plan works. We've been in this program, both of us, for many, many years. We have covered this issue when the Bush administration and the Republicans were in power. They did the same thing. What we saw, pregnancy rates, not as skewed, but pregnancy rates going up, teenage pregnancy rates going up, abortion going up. The Obama people come, they put the services in place, they fund Planned Parenthood, abortion, and teenage pregnancy going down. So we're back to the same place we've been before, and we know what the evidence shows is when these policies are put in place, they hurt poor women, abortion, and unfortunately, and I hope not the legal one, but the scenario is there for a perfect storm.
You know, I'm just curious. President Trump has flip-flopped on ISIS, on Syria, on Russia, and on NATO. Why hasn't he flip-flopped on women's issues? Just I don't get it.
Yeah, I think it's an interesting question. I don't have the answer to that question, but I will tell you that Congress is working even more to take the next step in this process, which would be if the the American Health Care Act were to pass, we'd see Planned Parenthood reductions on the Medicaid side as well. So this is obviously a slippery slope, and this is the ability for the president to engage on this policy. But all we're doing is providing states with the latitude to do that. Not every state is going to make this choice to adjust their Title X funding.
Right, but most all the red states will.
Right.
Yeah. So. Yeah,
and there's a huge elephant in the room here is that Planned Parenthood and among other local clinics are filling a major gap. This is a patchwork system we have for healthcare in this country. And a lot of women in rural communities and other places, this is all they have. You know, the conversation about whether or not we could even fund maternity care, we can't believe came up a few weeks ago. These are not people who get what's really happening in the lives of women and people who need it most. We have a healthcare crisis in this country that we have to figure out. We're on the way to figuring out, and this is taking a step way in the wrong direction.
Are we going to see any reaction, or are we going to see demonstrations? Are we going to see riots? I mean, this is millions and millions of women we're talking about.
It is, and you know, this is a good question here, and I'm glad that we're talking about low-income women, is that these are the folks who have the least voice in this conversation and in this debate, and hopefully there'll be more Susan Collins out there who will step up and say, we can't have this in our communities.
And Bonnie, a majority of these women voted for Trump. They're in the states, rural communities. They voted for Trump. That's what is so difficult to see how it's sort of a cognitive dissonance, no? That they voted for one thing, and they're getting something else.
Well, are you talking? I would say the white women voted for Trump.
Not
the
minority.
Women of color did not.
They did not.
You're right. But they're the majority.
Okay.
You asked about a pivot, and I think that the fact is that community health centers, there are 20 community health centers for every one Planned Parenthood clinic in the country. So there is a resource for these women, maybe not the most ideal resource, but I think what you'll see by the time September comes around.
Will they fund?
Well, that's what I was going to say,
control?
is that September, until we get to September, when funding becomes reauthorized for community health centers and federally qualified health clinics, I think there's an opportunity for the president to potentially pivot and provide additional resources for these clinics.
Right, and I disagree that he flip-flopped. I think there's been an evolution on some of those issues. But on
I was reading that headline, that very headline from a cable news network.
But it doesn't mean it's right. We know this. But I would say there's a reason that this bill signing was in private, not in public.
Right.
It's not something that he really feels comfortable with, and others on
Is
his
he being
team feel
pushed by
comfortable with.
Pence?
Well, I think there's part of that, but I think he's fulfilling a promise too. And I think we will find a way out of this because, again, ultimately, if their goal is to reduce abortion,
what's the way out?
The way out is education for people who don't understand that you cut family planning access, you increase abortion. And the people who are at that signing, yeah, they do. The people who are at that signing
doesn't care.
Yes, they do.
He's such a
they do.
You know,
they're not
an evangelical biblical adherent.
No, they want abortion.
Care.
No, they want abortion reduced. And I got to tell you, the conversations I've had for the last 20 years with these people, there's incredible ignorance. They don't understand the direct correlation between effective family planning and what we have now is okay family planning. We need to make it even more effective if we want to impact the abortion rate.
I mean, I have been out there. I've interviewed members of Congress, female and male, who are evangelical Christians. I have talked to them out in the. They just think they want women barefoot and pregnant.
Well,
and when they were just trying to overturn Roe v. Wade, before they got, 20 years ago, before they got to, birth control, they would say, oh, we don't want to touch birth control. Now that they have the power, they want to end access to birth control for not just poor women, all women.
I've had discussions with the people that you identified. I've been protested by the people you identified. I've been yelled at by the people you've identified. But it is a wedge issue on the other side because most of the people who are against abortion are for family planning because most do understand. The ones who don't, when you have the time and the opportunity to have a quiet, reasoned discussion with them and show them the information, but then also point out that the family planning we have now is still not as effective as it needs to be.
It
does move them.
All right. Let us know what you think. Please follow me on Twitter at Bonnie Urbay or at To The Contrary. From Title X to Gender-Reassignment Surgery.
Should health insurance cover gender reassignment surgery? 2 transgender women who work at the University of Wisconsin say yes. They and the ACLU are suing the university, its board, and insurance company for refusing to pay for it. One of the plaintiffs already paid for the surgery. The other has put off the surgery, knowing coverage would be denied. The lawsuit claims discrimination against transgender people by depriving them of medical care for the condition, quote, gender dysphoria. Sarah McBride, a transgender woman who works for the Human Rights Campaign, believes Wisconsin will lose.
It's a cruel action to take away medically necessary health care to transgender workers in the state of Wisconsin. The reality is that transgender people need and deserve access to medically necessary transition-related care. And to allow for these services to be provided for every other reason, but to deny them to transgender people is discrimination, plain and simple.
Republican Governor Scott Walker blocked a plan to add those benefits. His spokesman says the policy is legal, and forcing taxpayers to fund sex changes for state employees is unreasonable. McBride says more than 130 anti-LGBTQ bills have been introduced in 30 states this year, but she says there are countertrends.
You're going to see more and more states adopt non-discriminatory policies. You're going to see more and more corporations adopting inclusive benefits. And we're going to look back, and I think the state of Wisconsin is going to regret this decision made by Governor Walker.
So, Latifa, are the states that are going to adopt inclusive health insurance policies and the corporations, by the way, that stick with paying for that in their insurance plans, regardless of what the state's laws are they the same states that will keep Planned Parenthood clinics open?
Well, hopefully, and I think when we're in this business of picking and choosing, what medical care that we're going to be covering, we're in difficult territory for sure. And these are decisions made between their doctor and the patient. These are medically necessary. This is not cosmetic surgery. There's a lot of myths around this, and this is not. We don't have the option. We don't have the option to say you can get this service or you can get this medical procedure and you can't. I think we've got to go back to leaving these medical decisions in the hands of the patients and their doctors, and that means coverage for these patients when it's medically necessary.
We saw this in North Carolina. I think there's a lot of lack of understanding about the transgender community, and I think the issues that face them, whether that be medically or emotionally or physically. And I think one of the things that's happening in Wisconsin, which I tend to agree with, is that Walker's made a decision based on partisan lines and acknowledging the fact that he doesn't want taxpayer dollars funding sex change operations. It's much more complicated than that, and I think a lot of the work that needs to be done needs to be about educating people about treatment options, which are not entirely focused on surgical procedures.
Let me tell you, someone that the issue of transgender have been very close to my family. A very close friend of my son transitioned from female to male, and I knew her, well, not know him, and the family when they went through, and it really was a matter of life and death. I mean, really. For him, the identity was so clear, and they did the surgery and the complete transition. And I can sort of value the importance of providing that service. At the same time, I'm from such a different generation. It was very sort of, for me to grow into understanding what was going on was not easy. So I can see how the politics of it can still be so complicated. In a country we're still battling for, basic, reproductive services.
And transgender people, Americans, are 0.7% of all Americans, but 1.7% of Americans under the age of 18. So clearly, I just wonder, as more and more people came out as gay and lesbian in the 70s, 80s, 90s, how more people, like, for example, former Vice President Dick Cheney has a gay daughter. As more people interact with transgender people in their personal lives, will opinions start to change the way they did with gay people?
And I think you have to have more than just Caitlyn Jenner out there as a spokesperson. General Pritzker, who made the transition to female, having somebody out there like that, people who are not expected, is going to help re-educate. But on all of this, where only one side of the equation is having their services cut or their rights denied, we need to find commensurate things on the other side. They say, all right, you're not going to cover this, then let's not cover that. You're not going to cover, maternal care, then let's not cover Viagra. I mean, let's have some quid pro quo. That'll help move the needle as well.
I also think we generally just need to take partisan politics out of healthcare. I think this is it's
novel
a no,
idea.
It's not it's not a winning conversation.
Right.
No one wins. Everyone, we always have a losing side. And I will say that the
But
conversation.
wait a minute. No, you're saying no one wins. Obviously, Scott Walker thinks he won. And,
well,
he's appealing to his base.
Yeah, but no one wins. She's right.
I mean,
I think we all agree.
Yeah, it's the other piece of this, though, is I do think on conversations and how we're moving culturally that during the Obama administration, including increasing protections in the workforce and other areas, we have changed the conversation quite a bit, especially in the areas of education around in the education systems and on transgender individuals and Americans. And we, hopefully we can continue that progress and that we don't, again, see another rollback on progress we've been able to make.
My experience is we've changed the conversation in liberal hotspots like New York and San Francisco, and not
in
much
North Carolina.
I mean, well, sort of. Yeah,
and look at the Congress. Look at the debate.
Right.
Look at the debate on the healthcare, on the Obamacare and repealing Obamacare. That was like 19th century discussions and some basic services. Trying to cut them, and a room full of men making decisions about women's health.
All right, keep that in mind. But now we go behind the headlines. First Amendment rights. Whether it's a women's march, battles over fake news, the use of anonymous sources, or violent demonstrations against inflammatory speech, Americans are getting lessons on the Constitution nearly every day. To the contrary, spoke with one woman who uses her personal experience to teach young people about those rights.
More Americans than ever before are in favor of free speech, including unpopular or unfavorable speech and religious freedom, regardless of the fact they live in a nation facing terrorism. That, according to the 2016 State of the First Amendment survey by the Museum Institute, which also found 39% of Americans could not name one of the 5 rights listed and guaranteed in the First Amendment.
There's a shameful lack of knowledge about the Constitution and about the First Amendment. I've seen statistics showing that 1/3 of Americans don't even know any of the 3 branches of government.
Mary Beth Tinker is a First Amendment advocate and free speech activist from Des Moines, Iowa. At the age of 13, she and her brother donned black armbands to oppose the Vietnam War and support a Christmas truce. That action put her at the center of the landmark U.S. Supreme Court case Tinker v. DSM Independent Schools. Eventually, her activism led to her work with the American Civil Liberties Union to fight for student and faculty freedom of speech in schools. She continues that work today with the Tinker Tour.
I like to encourage students to learn about the First Amendment by using the First Amendment. And they are doing it so well and so often around the country right now. Students are speaking up by wanting to wear T-shirts that say Black Lives Matter. Other students in California wore shirts that had the American flag on them, but they had to learn you cannot substantially disrupt school with your speech, and that is straight from the Tinker ruling of 1969, having to do with free speech rights. So the students were wearing the American flags to mock the Mexican kids.
Tinker believes the nation is in a First Amendment crisis. She cites some examples. They include President Trump's attacks on the news media and his public denigration of judges, especially the one who stayed his first travel ban.
The disrespect that is coming from our president right now towards the basic principles of democracy are terrible. They're very harmful to not only students' understanding about democracy and the First Amendment and the 3 branches of government, but they're harmful. They wear away at our respect for our democracy.
Recent incidents at universities involving controversial speakers have sparked debate about unpopular speech, as some forms are protected by the First Amendment. Former Breitbart editor Milo Yiannopoulos was invited by college Republicans to speak at UC Berkeley, but after riots broke out over that appearance, the event was canceled.
And I think he should have been allowed to speak. Ironically, when you censor people, in the end, it ends up giving them more power.
Tinker versus DSM Independent Schools was decided in favor of Tinker in a 7-2 ruling stating, quote, "Students do not shed their constitutional rights to freedom of speech or expression at the schoolhouse gate," end quote. The case has been cited frequently in other cases to protect the rights of students and faculty.
There are so many things that students are doing today to stand up for their rights, to keep the First Amendment, the right of free speech, the free press, the freedom of religion, the freedom to assemble, and the freedom to petition for grievances.
Do you agree that we're in a First Amendment, young people particularly, in a First Amendment crisis now? And what, if anything, does the current administration and Congress have to do with that?
Well, I think we're at a period in which we are testing the boundaries of the First Amendment. I wouldn't call it a crisis because in some other countries journalists are being killed and people are in prison. I don't think we have reached that level here. And I think she very much captures sort of the boundaries. So you have the Trump administration and the lies out there saying the media countering, and they're calling the media fake news. So that dynamic is a test of our First Amendment. And to the other side, what's happening in universities. And I totally agree with her. I'm one of those that I believe everybody should talk. You know, I love these shows because we have people of different opinions, and it's very important. And when universities get too sensitive about how people are going to feel about opinions, I think it's totally inappropriate because that's what a college experience should be. So again, I think we're testing the boundaries. And it feels that we have a strong country, but we need to be engaged because it can be really threatening.
I think she's about half right. These things happening on the college campuses shows that free thought is not being taught. People are being indoctrinated. And it's
Were you
disgusting.
surprised that a liberal, progressive campus like Berkeley would have riots against a conservative
It's
speaker?
unbelievable. Well, no, because we've seen so many of the liberal campuses that this has become, again, indoctrination, not teaching independent thought at all. It's really pretty disgusting. But beyond that, we do have a crisis going on, not just because of things Trump says that sometimes are incorrect or misunderstood or whatever. It's because the press is not being responsible. Whether you start with the very first day, the report that he'd removed the Martin Luther King bus, which was a total lie, to things very recently. R.A. Fletcher, I think, made a really great point when Sessions went down, did his session down at the where the border wall is going to be. He said the Washington Post had an article. They had 4 people in the article quoted. Not one single one was anybody that represented anything other than a liberal viewpoint. And he said, you know, the Post should know better. Journalists more and more are doing that. The things they're writing are so biased, and there's not even an attempt. Unfortunately, they can't all be like you and invite diverse opinions.
I don't think we're going to have a successful debate on whether or not, you know, the media versus the president. I think most people are going to err on the side of believing the press at this point. There are lots of reasons that people don't believe the president, and putting that aside, you know.
Well, but doesn't that take into account, or does it not take into account, what your view of the press is? For example, we have a nation of progressives and largely educated people reading the New York Times and watching CNN or MSNBC, and then we have, you know, conservatives reading Breitbart online and the Wall Street Journal, and or at least the Wall Street Journal editorial pages, and then watching Fox News. And people have completely opposite impressions of what exactly happened about particular stories.
It's true, and you know, ideally we need to have, you know, neutral sources to provide good information. We don't have that, but that is something we should constantly be striving for. I don't think we throw the baby out with the bathwater. I think we continue to demand good, honest, and fair reporting. On the other hand, in terms of the free speech conversation, yes, people have been galvanized around this idea that I can say and do whatever I want, and you absolutely can say. But you know, you also, there's a First Amendment right, but you don't necessarily have to listen to it. I feel a little different about this. The students, they, you know, had an opportunity to hear from someone they didn't want to hear. They didn't have to show up.
I think we're in a period of rebuilding, if you will. I think the election environment created a very tense deterioration of civil discourse. I think what Tinker talks about is fantastic. Because
but that had been going on way before
absolutely,
the Trump campaign.
but we have to do something.
Since 1994, since Gingrich was House Speaker.
Sure, I don't disagree with that, but I guess my point is that from the standpoint of finding a way to recalibrate as a society, some of this requires civil discourse and an engaged dialogue between people of different viewpoints. And I think some of that is taking place, but it needs to take place in our school systems. People need to understand civics, what the First Amendment is, what branches of government are, what the Constitution says, so that we can preserve the integrity of our democracy rather than tear it down.
And I think, and I would add to that, but this is obviously not going to happen. Get rid of talk radio. That's it for this edition. Please follow me on Twitter and visit our website, pbs.org/to the contrary. And whether you agree or think to the contrary, see you next week.